There are a lot of considerations you need to take into account when you decide to pursue a direct to employer contract. Some of those you want to think about upfront, like the legal considerations we just discussed in the previous video. And after all of those boxes have been checked, then you really want to think about how this is going to impact your clinic. And so this is the tool that we've built to help you look at that. And we've built it in a more of a longitudinal time frame because some of these things are going to happen at different phases of the process. So to start, the first date you want to fill in here is when you start using this. So essentially today's date, if you were to start using it. The go live date is the date that the contract is planning to go live. So that's kind of your end goal. You want to have all of the things done by that date. And then down here, I've built categories. So what are your staffing needs if you were to when you bring these direct to employer contracts on? And if you do need to increase your staffing, what steps do you need to take? Do you need to advertise and then interview, hire, train? Do you want to offer any sort of incentives for the therapist seeing these patients, some sort of bonus structure or something like that? And how do you want to develop that? So you can add in additional tasks here if you want. You can assign them to different people. You can keep track of your progress. And you can know when you start it and how many days you think it's going to take. So you could set aside 3 days to complete interviews, and then you'll see this adjusts over here, showing when you should be finished with that. The next category is data needs. So are you currently using patient-reported outcome tools? Are you tracking your visits? Are you tracking your revenue? Likely the answer is yes to most of these, but if there are not things in place that are going to help you, one, market this to employers, two, show value over time to be able to grow this, and three, to really keep a pulse on your practice and the payer mix that you're going to see coming in from traditional fee-for-service compared to the value-based contracts. So making sure you have a good tool. We do have some later on in step 6 of operational oversight that you can use as templates, and it's also something that we offer additional individualized support on as well. But it's good to think about it up front so you know what you have and identifying any gaps. Then you want to think about equipment or space needs. Do you need to change the layout? Do you need to buy new equipment to accommodate this type of population that you anticipate coming in? And then what are the administrative needs? So do you need to have a different scheduling template if there's access expectations, or if there's expectations of one-on-one visits or hour-long visits? Does that look differently for your administrative staff who are scheduling patients? Are there different forms that are needed for patients to fill out when they're coming in under these types of contracts versus your traditional referrals? The answer might be no, you do everything exactly the same, but you may handle these patients differently and manage them differently. So some of those adjustments may need to be done. If not, these can be deleted and taken off of your checklist. But this is just a list to start you getting to think about what may need to be adjusted, and then you can go from there based on your own practice. This is something that really is specific to your own clinic, and you're the best one to fill this out. It's very intuitive. This is not one of our individualized support options, only because you're the best person to fill this out when you know your clinic and your current state and what your potential future state might look like. This is just the tool to help you get organized and set timelines of when those things would need to get done.